Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
For centuries, ancient cultures knew the secrets to longevity, vitality, and healing. Now, modern science is catching up. Ageless Blueprint is a podcast that will reveal the modern secrets of better health and a better life. Join Dr. Eldred Taylor here today and every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. As together we discover the secrets to better health through science and spirituality. A better life with Ageless Blueprint starts now. Here's your host, Dr. Eldred Taylor.
Hello, good morning, and happy Wednesday to everyone. I'm here in not hot Atlanta, but cold Atlanta. I think it was like 34 degrees last night. So I'm trying to stay warm, and we're not used to this kind of weather down here. And we have a guest today who's in Louisiana. She's freezing too, and also Rebel. She's in Louisiana. It's cold all over, but it's supposed to start warming up here soon. Well, today we're going to talk about, is maybe cold here, but we're going to talk about a hot topic. And the hot topic is that the FDA removed the black box label from hormone replacement. Now, I have a special guest here. Her name is Mandie Romero, Dr. Mandie Romero. She's a pharmacist that I've known for over 20 years. And we've been fighting this hormone replacement battle together on stage and at conferences. And since I started this Ageless Blueprint, we kind of reconnected because I went through a lag here where we didn't do with COVID and all that stuff. I didn't do a lot of speaking engagement. I didn't do any. And so this Ageless Blueprint kind of got me revved back up again. And she actually contacted me and has been following me on my Ageless Blueprint School platform. And we did a previous podcast together. And so I invited her back because when you talk about the FDA and hormone replacement, we have to put in compounding pharmacies, because compounding pharmacies have been fighting this battle even more than I have, because Big Pharma is always trying to shut them down. So let's welcome Mandie Romero, and then we're going to discuss this hot topic in this cold environment. How are you doing, Mandie? Dr. Romero, let me give you a proper introduction.
Very cold.
How are you doing,
thank
Dr.
you.
Romero?
Yes, thank you. Thank you
Okay,
for inviting me back.
Hey, why don't you tell us a little?
This is such a hot topic, and I think both of us have, our viewpoints, but they definitely merge together. So I'm excited to be here.
Exactly. So why don't you tell us yourself and what you do?
Okay, so I'm a clinical pharmacist. I used to work for
I think we're having some
large.
delays. What's going on?
Oh,
There's about a 30-second delay between what you hear and what Dr. Mandie says. So if you guys would give enough time in between y'all's talking.
Okay, I'll try and give it time.
okay, so
All right.
space.
Dr. Romero, let's start from the beginning. Let's tell us about what you do and how you kind of got to this point.
Okay, so I started off as a compounding pharmacist 26 years ago. And so I learned how to make compounded HRT. And then my boss at the time said, let's get this going. Let's start learning. I started learning before the WHI trial came out. And so I was learning all the good stuff. And then 2002 comes and that changes everything. But irregardless of that, at the time, I was learning about HRT and I was marketing to physicians, educating them what I learned, and then seeing patients in private consultation. But in 2013, I got very sick. And so I had to quit working there. So my health journey has taken me down the road of a hysterectomy. And so then I had to go about figuring out what am I going to do about my own hormones. But before that, I was helping women with hormones. And, it has evolved into functional medicine, helping people with metabolic health, those kind of things. So very preventative and wellness.
Yeah. So, the thing is that the FDA changed this black box warning. Now, the way I see it, it has good things and it has bad things. I think one is going to start the conversation again about bioidentical hormones. And I think that's so important because, as you know, and I know, women are suffering due to the lack of knowledge from doctors not having the knowledge and from just educational institutions. We talked about the North American Menopause Society giving bad information.
Mm-hmm.
And so I'm worried that lifting this ban is going to allow the people who are distributing bad information to do it more freely. And so that's why I wanted to do this podcast, because I think it's important for women to understand hormones and how they work and what to avoid and what to, incorporate. So this podcast is trying to educate women to be empowered to make good decisions for themselves, because I feel like a flood of information may start coming out now that this ban has been lifted. How do you see it?
I totally agree with you. And we've been battling this a long time, Dr. Taylor. I mean, it's all the time, and especially more so as a pharmacist, because I can't write a prescription. So I have the knowledge that I've learned that is science, and I'm trying to get the doctor to say, hey, let me collaborate with you, and this is what I'm recommending for the patient. And it's so frustrating. But now I think this opens the door for more discussion. But if you have doctors that are just going to start writing scripts and have no education, that's going to be a problem, especially with the generic lift of Premarin.
And we're going to get to that. So let's I like to use slides because it kind of keeps me on schedule. So can you pull up the first slide,
Yes.
Rebel? Oh, no. Okay. No, that's the last slide. Let's go to the first one. I can do it here. So we're going to get to Premarin, but so this is the big shift. Rethinking hormone therapy, a new era for precision education. So this is the headline. It was all over the news a couple of days ago. Robert Kennedy, he's a little bit more holistic minded, and I know he has good intentions. And it's just like with everything. Everybody always has good intentions, but sometimes you get, those unexpected consequences or whatever, that collateral damage. So again, I do think this is good because people are starting to talk about it. And, I actually started this podcast and all this stuff because there's so much misinformation, out there on the internet and all these places. And so I just want to make sure that everybody is equipped with good information so that they can navigate all this stuff, so they can hear what we're saying and compare it to, what's being said. And they can I feel like patients are smart enough to know what's right and what's wrong, and especially women, because women have intuition, and intuition can be very powerful if women will abide by their intuition. But a lot of times they get confused by this information and go against what they feel is actually right for them.
Totally agree with that. Women really have it in them to take it to the next level. And I think if we get out there and educate more from the women's perspective, especially with what's going on right now.
Yeah. So, so I put in there what changed. Okay. They removed the black box, but look, what didn't change? There was no direction on how to measure and balance hormones, so that did not change. And now there's continued guessing and trial and error. And so go ahead.
So what I was going to say is so what do we do? Business as usual?
Yeah.
No, we're going to have to take some steps to educate people so that they know how to do it. Yeah.
Yeah. Yeah, that's the problem. The problem has never been the hormones. The hormones, estrogen and progesterone, I mean, women and men, they make that. You've been exposed to estrogen and progesterone your whole life. Okay, so estrogen and progesterone are not the problem. The problem is the
Yep.
balance of estrogen and progesterone, is measuring the estrogen and progesterone correctly so that you can restore balance if the person's out of balance. And I always say, there's no way to balance something if you can't measure it. You have to be able to measure it to balance it. And our problem is what I was taught and what's still being taught is that you cannot measure something in the blood that is fat soluble. Hormones are fat soluble, so you can't measure it in the blood. And we're going to show you, Mandie gave me the book that just explains this, totally. We've got to measure right, then we can treat right. We haven't had the proper measurement. I did a whole residency in OBGYN and we never drew blood to measure hormones because we knew it didn't tell us anything. But we have all these people out here who are basing hormone replacement on blood levels, and it's going to cause a big problem.
Yeah, we really have to go back to science, Dr. Taylor.
Yeah. Yeah. And so speaking of that, let's look at this. Can you see this?
Yeah.
Well,
I love it.
So you can tell them what this is.
Okay, so one of my doctor friends gave me this book, and I used it because you are the one that told me where the information comes from about hormones. This is what OBGYNs learn from. So I was like, okay, I got to get this book. So I got it from a friend, and then I actually bought a newer one on a used book site for like $4. Nobody wants to read it, but I do. Anyway, but the point about this is I never noticed the back of the book until one day it fell, and I looked and I'm like, what is this on the back? Oh my gosh. I was like, wow. So the drug companies are now giving the literature to the doctors to learn.
Yeah.
But like you said, that y'all didn't even learn about birth control. So why are they even advertising?
Well,
Wow.
Here's how I look at this. And this is all this mind game, is that there's this law of reciprocity that people just naturally do, that if somebody gives you something, you feel like you have to reciprocate. So I feel like that the drug reps, they would give us books and they would take us out to dinner and all this stuff. And so then when the low estrogen guy comes back, it's in our head that we should prescribe low estrogen as the birth control pill. But here's the funny thing. The GYN endocrinology book does not teach you how to use birth control pills. You know why? Because birth control pills are not a part of your physiology. So that's the crazy part. Okay. So
that is the crazy part. Yeah.
Yeah. You're not going to see low estrogen in the GYN endocrinology book because those chemicals in the birth control pill is not a part of physiology.
We're digging all this up right now, right?
Yeah. And so, I did a lecture for a long time called Hormone Replacement by the Book. And everything I have in that lecture comes from this book. Now, the problem is with the people on the internet and all these doctors who never have done OBGYN, and even some of the OBGYNs who have not gone back to look at the textbook because we've been so indoctrinated by pharmacology. They don't realize that what they are teaching and what they're telling patients and what people are saying on the internet does not come from the GYN endocrinology book. And I also say that if you go to an endocrinologist, they are not required to read that book. So endocrinologists don't really understand GYN endocrinology. No, this is a GYN endocrinology book.
Who is supposed to do this, Dr. Taylor?
OBGYNs are supposed to do it.
Right,
But
that's
look,
true. Yeah.
Yeah, but you know what? I read that. I had that book. But here's the problem in medicine, and you know that. It's see one, do one, teach one. So if I see a higher level resident do something, he's going to teach me, and then I'm going to do it. So it's going to be see one, do one, teach one. So all you have to do is to get the ball rolling. You get people, you get the doctors, hey, you use birth control pills. Oh, that's how you treat problems in women. That's what I saw. That's what I did. That's what I teach. And that's the same thing that what they were doing 30 years ago, they're still doing it now. There hasn't been any progression in how we treat women and their hormones. And I think that's a big disservice to women. And that's why I'm trying to start this revolution that women demand proper treatment when it comes to hormones.
Yes, sir. I agree with that. And I think the more we get out here and talk about testing, is that our next topic?
That's our next topic. That's
right.
our next topic. And so, so here's the problem. Yeah, go ahead. Go ahead, Andy.
Yeah, I was just going to say, let me just ask you, in the book anywhere, is there anything about testing levels in the Bible?
This is the one thing it says. And I quote this over and over again, that in Spiroff, it says serum measurements of steroid hormones gives you limited clinically useful information. Okay? It says if you measure hormones through the serum, you're going to get limited clinically useful information. Okay? So we're going to get to that slide so I can show you. And I believe that this is simple enough for anybody to understand. And that's the problem. It's so simple that people don't believe it's that simple because it's been so much confusion for so long. Okay. So yes, that's the one quote that's in there. It says, if you measure in the blood, you're not getting good clinically useful information. Now, it doesn't say anything about saliva testing, but saliva testing has been around since 1960. And I can give you plenty of references on that. Okay. So that's the missing link. It's no way you can treat blood pressure without measuring a person's blood pressure. There's no way to treat cholesterol or diabetes without measurement. And we've got to start measuring correctly. And I know you and I have been doing saliva testing for over 20 years, and it is clearly the best method to understand and to treat women and men. I know we're talking about women because they're primarily who we're talking about, but in men also, because they lifted the ban off of testosterone as being a controlled substance, I believe. So, but anyway, so you can tell me your experience with saliva testing. Yes. You can tell me your experience with saliva testing.
I can tell you, I've been using it since I started. And maybe it's because Dr. Taylor, as a pharmacist, when you go to these conferences, you're a little more open-minded. Okay. We are not bullied in school. Okay. Like doctors are sometimes. And so just as a person, I'm more empathetic. But I go to these conferences and they're like, okay, here's the data. Here's how it works. And I see it every time I measure levels. The patient will come to me. The doctor did blood work. There's nothing wrong, but yet I have all these symptoms. I'm like, okay, well, let's do a saliva test. So we do a saliva test. We test the estrogen, the progesterone, the testosterone, the DHEAS, and the cortisol. And there we go. Now, it may not tell us everything because some of these patients have complex medical histories. But as far as the hormones, it tells the whole story. And then what I really love about it is that the patient fills out their symptoms on the sheet. So then the lab will take the levels and the symptoms and they will explain it for you and help you walk through it. So I feel like physicians, if they want to do a better job, any clinician, they want to do a better job, they need to learn how to use the best tool. And we know that saliva is the best tool to measure levels.
Yeah. And, I won't talk about this, but I know there's another popular test that looks at urine, and I'm not going to say the name. And here's my problem with that, is that when you're looking at urine, you're looking at metabolites. So you're looking at how is the hormone metabolized, and that is primarily a function of the of your detoxification system. Is really a function of how well your liver is detoxifying the hormone. So you could have a low amount of metabolites, not because you have a low amount of hormone, but your liver is not detoxifying it properly, and you can still have a backup of hormone in the cells. So that's why, people talk about blood, saliva, and urine. And how I feel is that, hey, if you want to look at metabolites, urine is the place to go. If you want to look at what is affecting the cell, the saliva is the way to go. If you just want to look at an overall level, the blood is the way to go. But in the blood, like you said, if you're premenopausal, the levels are always going to come back normal because they're not measuring the balance between estrogen and progesterone. They're just measuring the totality. And I'm going to get to a slide that's going to explain this. But yeah, so there's always these comparisons between how do you measure it. And for 25 years, I've found that saliva is the best way, and it correlates the most with the person's symptoms. And it finally gives them an explanation, because I can't tell you how many times that I've gone to the doctor and they told me my blood tests were normal. I hear it almost 100% of the time. And so we know that something's wrong, because how can somebody have fibroids and irregular bleeding and breast cancer and even uterine cancer, and the blood levels are normal? How can that happen? So, but in the saliva, you can see
it's crazy. It's
estrogen,
crazy.
Yeah, go ahead.
Yeah, the estrogen's there. It's there. I mean, it's just we're looking in the wrong way. But not only that, Dr. Taylor, patients aren't even given instructions on how to do the testing, blood tests, whatever, when they're having a menstrual cycle. That drives me insane. They will bring their blood test to me and they're like, here. And I'm like, okay, well, what day of the cycle are you on? I don't know. They didn't tell me anything. I'm like, well, this was a waste of money for you. It's very frustrating. Yeah.
Because, I think the problem is that there's a lot of people out there doing it who started doing it because it became popular, and now it's going to become more popular, and they don't understand this. And you can see this. And I just want to show this one thing. This is what your hormones do over the course of 28 days. This is 28 days. And all I want to show you is that this is estrogen and this is progesterone. So you can see how if you measure here, it's going to be much different than if you measure here, or it's going to be much different if you measure here.
Right.
So that's what Dr. Romero is talking about. You have to know where in the cycle you're going to measure it. You have to know what is the ratio of estrogen to progesterone when I'm measuring it. Because you were asking me, why do they draw LH and FSH in the blood, right, Dr. Romero?
Yeah.
Yeah.
Yes.
Yeah, because they don't understand
I was asking,
saliva. They just
why are they doing it at the beginning of the cycle?
Yeah. So let me tell you what happens. Your brain tells your ovary to start this process of making an egg right here, and LH and FSH is what causes ovulation. So they look at that to see if you ovulated, and if you ovulated, they say, oh, you must have made progesterone. But did you make enough? Did you make too much? Did you make too little? So that's why you need to measure it right here when the progesterone should be the highest, and you're looking at this balance right here. Now, if you're menopausal and you're not having a cycle, you're just trying to make sure that there's a balance between here on a steady state. And then if you are giving somebody hormones, you definitely have to look at the saliva, because that's the only way you can manage a person on hormones. Because if the hormone is not coming from the ovary or the testicle, it doesn't spend hardly any time in the blood. It goes right to the tissue. So I'll show you that, I think, in the next slide. Do you have anything else you want to talk about the menstrual cycle? You brought it up about measuring at the right time. Well, I hope she heard me. Did we lose her, Rebel?
Yeah. So I think that
Dr.
Taylor,
I'm gonna go back to this. Yeah, you had a little delay, but I'm gonna go back to this one. Yeah, you're here. I can hear you now. So I was asking you, do you have anything else you wanted to talk about? What people need to know
but
about
I think this
cycle?
is the main point I want to draw. I think that practitioners, clinicians, patients need to know is that when a doctor gives them an order for blood work, if it's blood work, I mean, we'll just go with that. But we know saliva is better. They should be asking for saliva, but if the doctor's not educated, then that's going to cause a problem. But even if they go to the doctor and the doctor says, hey, I'm good with measuring your levels, they need to know when in the cycle. So this is very important, because it is the most frustrating thing when a patient goes and does the labs and then you can't tell them anything because you have no idea what it means.
Yeah. And again, you're just trying to explain something that if you're going to do a bad test, at least do it at the right time. Okay.
Right.
It's a bad test, but at least do it
Yes.
at the right time. So it looks like you know what you're doing, even though you're not doing it. Okay.
That's
Yeah.
right.
Yeah. So at least you look like it.
Yes.
All right. So, hey, we got 5 minutes. And this, I want to,
Right.
my ultimate goal
Can I ask
is
you
to
for
have
you?
yeah, go ahead. Did you say something?
Yeah,
All right.
I
Hey,
said, oh gosh, now I can't remember. Go ahead. Just keep going.
okay. All right. I'm sorry. This is happening.
No,
We're
keep
going to
going.
try and fix it maybe at the break. So, hey, I'm trying to. I want somebody. I think people can understand this. Okay. So let me show you the difference between blood and saliva. All right. So I'd like to use this analogy that hormones in the blood. This is the blood right here. Okay. And this is the hormone. And this is what they call sex hormone binding globulin. And people measure that in the blood. But let me tell you why that doesn't matter. All right. So this is the free hormone that goes out of the blood into the tissue where the cells are. All right. So if you're measuring this, you have no idea what is here. Absolutely no idea. And this is what is available to the cell, is what came out of the blood and came here. And this could have come 2 weeks ago. This could have come 2 days ago, but it's still sitting here available for the cell. All right. So in the blood, it's not telling you what you can actually use in your body because that's not in the blood. It's in the tissue. And why can I use saliva to tell me what got delivered to the tissue? Is because these little cells around the saliva gland are like these little cells. So they're the ones who take in the hormone and they can use it. So, and the saliva reflects what is in these cells. So if I know what the normal balance of hormone is in the saliva, I can assume that that same balance is in your breast and in your brain and in your uterus and in your heart and in your muscles, because all of those tissues use hormones. So that is the difference. This, you can have a whole lot of hormone here and not much here, or vice versa. This is where the action is. The blood and the circulatory system are a highway system. It's a transportation system that delivers hormones to where it needs to go. And you only want to know how much hormone is there that I can use. And that's it, plain and simple. It's not that hard. And I'm on a crusade to teach anybody, patients, doctors, whoever, this simple information, because once you understand this and you start measuring things through saliva, a whole world opens up to you and a whole new group of people you'll be able to help if you can just understand this. And I believe anyone can do it. I really do. So, Mandie, you can expand on that. Okay.
Okay, so I think what we need to do, Dr. Taylor, is relearn. You know, we need to learn, we need from this information, practitioners, I think the message is it doesn't mean that you don't really know what you're doing. It just means that there's newer, which it's not really newer. It's just we have more information. We have
Yeah.
a better test, a better test. So why not use
Yeah.
the better test? And don't let the insurance companies tell you what to do. You know,
Exactly.
it's there. And just because you don't have a drug rep coming in the door doesn't mean it's not valid. Look at the data.
Exactly.
It's
Yeah. Yeah.
there.
Yeah. And just like you're saying, don't let the insurance company damage your health. Don't let your health insurance keep you from getting healthy. And that's what it does, because health insurance is for sickness, it's not for health. So if you're doing something, and I'll just say this in general, if you're seeking something to help you to be healthy, then that's not what that's not what health insurance is. It's just for when you are sick. And the problem is that menopause is not a sickness. PMS is a condition. It's a condition of imbalance. And so, but yes, you're right. Just because the insurance doesn't pay for it, and some insurances will pay for it, but this is so critical. You can either pay for one of these tests that may cost you a couple of $100, or you can continue to suffer. And so not suffering is worth, I think, $200-300, and that's usually the general cost of these tests. So I think it's time for a break, Mandie. So let's go to our commercial, and we'll go, and then we'll come back, and we'll kind of wrap this up and just talk about how do we want to proceed? How do we want to make sure this message or this change of the FDA is beneficial, and we have limited to no collateral damage because of this information getting into the wrong people's hands. So let's go to break.
We are going to a quick break, so stay with us as we explore the ageless blueprint right here on W4HC Radio and Talk4 TV. An ancient secret with a modern twist for better health and vitality. Dr. Taylor will be right back. Taking care of your health shouldn't mean taking a handful of pills every day. At Taylor MD Formulations, they create doctor-developed supplements that combine the best natural ingredients so you get the results you need with fewer pills. Taylor MD Formulations is backed by science, designed for real life with real results. Less pills, better health, doctor approved. Shop now at TaylorMDFormulations.com and discover smarter supplements for smarter health. That's TaylorMDFormulations.com. We are back for more of Ageless Blueprint. Once again, let's join Dr. Taylor for more insights and research on the ancient secret to better health and a better life in modern times. Here's your host, Dr. Eldred Taylor.
All right, we're back. I'm here. I hope, I don't know, we may be rebooting Dr. Romero. I know I thank you for hanging in there with us. We're doing the best we can. We want to keep it going. Hey, Rebel, I saw that a question popped up. Is that correct?
Yes. We have two questions. Okay. The first one is, if the medicine makers are driving the medical profession, then they are not going to want doctors to get to the cause of the problem.
Yeah, you're right. You have to be a little bit of a rebel. You're right, Dr. Romero. Did you hear the question?
Yes.
Yeah.
We've been rebels for a long time, Dr. Taylor.
Yeah. You have to go against the flow, because you can get swept away in what media and the pharmaceutical companies and all those people want, but you have to go back and look at the basic science, and you just have to have enough courage to do what's right. It's easy to follow the crowd. It is real easy to follow the crowd. You just have to have enough courage to do what's right. And are all doctors going to do this? Of course not. Not all doctors do anything. But I'm trying to put it out there that the doctors I always have said you can't convert people who don't want to be converted. But there's some doctors out there like who were looking for a better answer. So we want to expose this better answer. So that's our goal, I think. Is that correct, Dr. Romero? And this is okay. All right. So what's the next question?
The next question is from Bonnie, and she said, one problem is people put too much trust in doctors. We don't educate people to know their own bodies.
This is like a perfect setup. And that is my goal. I created a lecture 25 years ago saying that I could make a patient an honorary gynecologist. And you can. And I said I could do it in 4 slides in 5 minutes. And these are 2 of the slides. And the other slide is understanding the menstrual cycle. And uh, I was going to announce this at the end, but I wanted to talk about this. And Dr. Romero, I've talked to her about it. But we are going to try to educate lay people, counselors, uh, doctors, anybody to be hormone clarity coaches, is that to give some clarity to hormone replacement, because we have to have a group of people who are putting out good information to combat the people who are putting out bad information. And there's plenty of those people out there. And Dr. Romero and I have been trying to do it for a long time. And now we're trying to recruit more people. And now I have a platform where Dr. Romero, we don't have to go and travel and do all these conferences. We can have a podcast. We can do all kinds of things to help educate people, just like that patient, the questioner said, is that you need to understand what's going on with you, and your body is not too hard to understand, and that's what we're trying to teach you. So, Mandie, how have you been fighting this educational battle?
Oh, well, since the beginning, but when I started 26 years ago, hormones, that was before the WHI trial came out. So it wasn't so hard, but I didn't know enough. But then fast forward to 2002 when all this stuff started coming out and the patients were calling me and they're like, the doctor wants to take me off my hormones. I'm like, no, remember what I told you. But then
Yeah.
it's me against the physician, and even now I think sometimes I'm a little intimidating. I try not to be. I'm only 4'11". but I write letters to doctors and ask for collaboration, and they get mad at me, Dr. Taylor. And I'm like, okay, listen, I'm not saying you're not the lead on this. I'm just saying I'm recommending this. Let me help you. I can spend an hour plus with the patient. You cannot. So let me help you. And that's what my purpose is, to help patients, empower patients just like you, but also, to get this information out to the physicians.
Yeah. Also my goal is I want to, the pharmaceutical industry, they've done a good job at doing this. So I'm like, hey, I don't need to reinvent the wheel. I can just do what they do. And what do? They have a commercial, and then they say, ask your doctor about this medication. All right. So I'm trying to get enough people, enough women to understand saliva testing, that they say, hey, doctor, do you do saliva testing? I want to have a saliva test. If enough people go in there and ask for that, you know what the doctor's going to do? They're going to seek information about saliva testing. And where can they get information about saliva testing? From people like us. So I'm trying to flip the script where doctors are going to come to you to get education instead of you having to go to them to try and shove education down their throat, because that's how the pharmaceutical companies do it. Get your patients, get the public to go start demanding something, and that's how they get these doctors to change. Oh, hey, they're professionals at it, so let's do it like they do it. What do you think?
I agree with you. And the other part of that is you're empowering the patient to learn about their health. So when patients are empowered and they want to be healthy, then there's less problems. You know what I really think, Dr. Taylor? I thought about this the other day. Doctors are inundated with patients because everybody is sick. There's too many sick people because we have poor food. I mean, we could go on and on.
Yeah.
But my point is that we're all sick because of our environment and XYZ, and is sitting and listening and educating themselves. And look, if I can take the time out, you can too, because that's what I had to do. I had to take time out to learn from other people that are experts. So
yeah. And what I'm trying to get patients to understand is that you can be an expert on yourself, because your body is always sending you messages. Every pain, every little, nuance, every little funny feeling, it is actually your body trying to send you a message. when you feel pain,
Mhm.
the goal is not to get rid of the pain. The goal is to see what is wrong causing the pain. And that's what you have to understand about when we are talking about balance and progesterone and estrogen. What's causing your problems are imbalance of estrogen and progesterone. And the only way to discover that is by measuring. You cannot rebalance something that you haven't measured to see what is out of balance. And so that's what we're trying to get across, is that everything is about balance. Cortisol, estrogen, progesterone, everything is about balance. And the last podcast, oh, go ahead.
And can I add something? Um, yeah. Well, I want to add something too, because we're talking about measuring just real quick. If you are giving if a doctor is giving a patient a hormone that is not identical to the body, you can't measure that. We have to stick. I mean, I'm sure we're going to talk about that later, but it's important to know that you're measuring and what you're measuring. You know, what kind of hormone are you giving the patient? And that's probably a good lead into what you're about to talk about.
Yeah. So, that's perfect. Just like you're saying,
Yeah.
that low estrogen, that birth control pill, there's no way to measure that progestin in that birth control pill because it's not bioidentical. And the saliva testing can only see that. And blood testing can't see what's in that birth control pill either. That's why I'm telling you, if you're taking birth control pills and hormones, you are
That's
flying by the seat of your pants. Okay, so has anyone ever given you a birth control pill, and then when it doesn't work, they say, "Oh, let's measure the blood level of the birth control pill. Maybe we can change, and we'll know what the next." No, you get switched on birth control pill after birth control pill after birth control pill because no one has measured and rebalanced you. So if you have a hormone problem, you're not birth control pill deficient. You're out of balance. Okay. And so that's the same thing with Premarin. So I know this is your pet peeve, Dr. Romero. So I'm going to let you talk about Premarin.
Yeah, about Premarin.
Mhm.
So Premarin, it's been out forever. And, now that it's going generic, that is not the answer. Okay. First of all, oral estrogen, based on information I've read, and if I can say, I think I'm an expert because I've been doing this for over 25 years. Oral estrogen has no place, I feel. We have too many other options. And the problem that people need to know about oral estrogen, and please add in, is that it increases clotting factors. That's one problem. But then you can't measure this. That's the whole point we were just talking about. You can't measure this. They don't even know what's in it.
Yeah.
They cannot tell you what's in it because it's from pregnant mare's urine. It's from a horse. So some people you say it's natural because it comes from a horse. Well, we're not horses. So it's identical to the body.
Yeah. Yeah. So, Premarin, this is, Dr. Romero, what I've had to realize is that we've been doing this for 25, 26 years. That's a whole generation. So this new generation of docs, they probably don't even know what Premarin is. So now you reintroduce that
They
into the
probably
market.
don't.
They think that's something new. Yeah. Yeah. Because since the Women's Health Initiative,
I never thought about this. You're right. Oh my God.
It's a whole new generation of doctors who don't even remember Premarin. That's what I used to give my mother, thinking that I'm a good doctor and, giving my mother Premarin until I understood this. So there's a whole new generation of doctors, and there's a whole new generation of patients who are going through perimenopause and menopause. So I'm worried that they're going to think Premarin is some new drug, because if you don't know your history, you're bound to repeat it. And we're about to repeat what we had to learn 25, 26 years ago.
You're exactly correct. And, I think like with this new era, let's call it a new era of women's health. Let's learn about the right things to use. And why are we not just, just per se, why are we not talking about the patches, like as an alternative instead of why can't we make, if we want to make something cheaper, let's not make Premarin cheaper. Let's make the patches cheaper. I mean, if that's what the deal is, because at least you would, you wouldn't cause the clotting factor issue. I mean, in patients that, they tell me, look, I don't have a lot of money. I have a set income. I can't afford a compounded medication, and not always it's expensive, but they want something their insurance will cover. I'm like, go, let's do a patch. I mean, at least it's estradiol and it's, bioidentical. So
I love patches. I love anything that you can measure. And I don't want to give anything that you can't measure because you're going to be doing trial and error. So I absolutely love that. And I just want to say, again, a small investment in your health could make a world of difference in you, because most of the women come in and say they have foggy thinking, they're fatigued, their moods all over the place. How can you be productive when you're feeling like that? How can you do your best at your job? How can you be creative? How can you be the best mother? How can you be the best spouse or husband? If you're feeling like that, and just saying one little investment could explain everything for me, and I could go and live the rest of my life feeling good again. I just had a consultation with a patient the other day. She was 65, she was retired, and she was like, I don't know who I am. I don't have any motivation. I don't have anything. And her hormones were out of balance. And I was telling her, you don't want to live the next 20, 25 years like this. We need to do something. And so that's what I'm saying. That's what I'm talking about. Don't let the insurance or all of that hinder you from fixing something that's fixable. All right. So go ahead, Dr. Ray. We got about 3-4 minutes left, and we can just kind of wrap this up.
Okay. So do you want to talk about what we need to do with this new information as far as training, and like what people really need to do, practitioners need to do? In my opinion, you need to start reading. You need to see, and it's like, what are you supposed to read? But, definitely saliva testing, read up on it, learn. As far as for patients, they need to do the same thing. There's great functional medicine conferences around the country all the time. I mean, that's a good place to start, don't you think? What do you think they should do?
Well, you can go to conferences, but then, here's my thought. I'm 65, and I feel like a lot of the people that we lectured with and all that, a lot of them have retired. They've, some of them have passed away or whatever. So I'm trying to leave a permanent education source. So I have a school platform, www. You'll see it down in all my links. And I actually started a hormone clarity coaching certification. And it's anybody who really wants to understand this and perpetuate this information. It's all in my school group. I have another school group called Beyond the White Coat, where it's specifically for physicians, so that I'm interested in trying to convert the people who want to be converted. And I don't care if you're a dishwasher at a restaurant, or if you're a PhD, or if you're an MD. Everybody needs to be educated on this, okay? And so I'm opening this up. I have a school group where you can just come and be a part of the community. It's free. Just please go to my links down there, and that's my contribution. Dr. Mandie is going to keep doing what she's doing, and maybe we'll work together on this coaching certification, so you can understand how compounding pharmacies fit into this, how supplements fit into this. So this is kind of the beginning. We really think that because the FDA lifted this ban, we've got to have more and more and more people understanding this, teaching this. And Thanksgiving is coming up. Learn this and talk to your friends and family at Thanksgiving and say, hey, I listened to this podcast, or I followed these two people, And hey, you need to understand this information, and maybe you'll cut down on the fights over Thanksgiving dinner, if you can get people's hormones straight. So maybe Thanksgiving will be better.
I agree.
So maybe
well, I can't go without mine. I can tell you that.
Yeah. Thanksgiving and Christmas could be a lot better if everybody had their hormones balanced. Then Aunt Susie and Uncle John, won't be fighting and trying to kill each other and throwing turkey legs at each other. So let's think of this as we're saving relationships and we're saving families by getting this education out there.
If I could add something, I hope that this podcast I hope this podcast alleviates the fear in women to ask. In the common thread for 23 years that women have been scared, the doctors are scared, the patient's scared, nobody wants to talk about it. Then next thing you know, people are pointing fingers at each other saying, oh, you're on hormones, you're going to die. It's not true. It's so not true. And so I believe with your information and my information, we can help people live a better life with better information.
All right, so we're going to end it with that because I know we're over time, and Rebel will fuss at me if I keep going. So thanks a lot. We'll see you back next Wednesday. Thank you, Dr. Romero, for being our guest. And we worked through all the technical difficulties. We heard everything you had to say. So we appreciate you coming on, and we'll see you guys next week.
Thanks for joining Dr. Taylor today. If you missed any part of this show, just check out the podcast wherever you listen to podcasts. Ageless Blueprint is every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. Together, we discovered ancient secrets to better health through science and spirituality made for modern times. Until then, feel free to check out agelessblueprintpodcast.com and TaylorMDFormulations.com for more information.